Good morning, class. It's Amber, of course. So today we're going to be talking about a very rare disorder. It is called Angelman syndrome. And so since this disorder is very rare, of course, it's hard to find information about it. And there was like no information about it in the book, very little. But I was able to find a video that is basically going to explain what it is and everything we need to know from it. And I know that since you all have a lot of PowerPoints to get through today, I figured I'd put this video so we can kind of make this presentation short and simple. All right.
Syndrome. Angelman syndrome is a genetic disorder. It causes developmental disabilities, neurological problems, and sometimes seizures. People with Angelman syndrome often smile and laugh frequently and have happy, excitable personalities. Developmental delays between about 6 and 12 months of age are usually the first signs of Angelman syndrome. Seizures often begin between the ages of 2 and 3 years old. Causes. Angelman syndrome is a genetic disorder. It's usually caused by problems with a gene located on chromosome 15, called the ubiquitin protein ligase E3A or UBE3A gene, a missing or defective gene. You receive your pairs of genes from your parents, one copy from your mother, the maternal copy, and the other from your father, the paternal copy. Your cells typically use information from both copies, but in a small number of genes, only one copy is active. Normally, only the maternal copy of the UBE3A gene is active in the brain. Most cases of Angelman syndrome occur when part of the maternal copy is missing or damaged. In a few cases, Angelman syndrome is caused when two paternal copies of the gene are inherited instead of one from each parent. Signs and symptoms. Infants with Angelman syndrome appear normal at birth, but often have feeding problems in the first months of life and exhibit noticeable developmental delays by 6 to 12 months. Seizures often begin between 2 and 3 years of age. Speech impairment is pronounced, with little to no use of words. Individuals with this syndrome often display the following that can have severe functional deficits: hyperactivity, small head size, sleep disorders, movement and balance disorders. Children with Angelman syndrome typically have a happy, excitable demeanor, with frequent smiling, laughter, and hand flapping movements. In addition to hyperactivity, a short attention span and a fascination with water are common. With age, people with Angelman syndrome become less excitable, and the sleeping problems tend to improve. However, affected individuals continue to have intellectual disability, severe speech impairment, and seizures throughout their lives. Adults with Angelman syndrome have distinctive facial features that may be described as coarse. Other common features include unusually fair skin with light-colored hair and an abnormal side-to-side curvature of the spine, also known as scoliosis. The life expectancy of people with this condition appears to be nearly normal. Diagnosis. A definitive diagnosis can almost always be made through a blood test. This genetic testing can identify abnormalities in your child's chromosomes that indicate Angelman syndrome. A combination of genetic tests can reveal the chromosome defects related to Angelman syndrome. These tests may review parental DNA pattern. This test, known as a DNA methylation test, screens for 3 of the 4 known genetic abnormalities that cause Angelman syndrome. Missing chromosomes. A chromosomal microarray, or CMA, can show if portions of chromosomes are missing. Gene mutation. Rarely, Angelman syndrome may occur when a person's maternal copy of the UBE3A gene is active but mutated. If results from a DNA methylation test are normal, your child's doctor may order a UBE3A gene sequencing test to look for a maternal mutation. Treatment. There's no cure for Angelman syndrome. research is focusing on targeting specific genes for treatment. Current treatment focuses on managing the medical and developmental issues. Depending on your child's signs and symptoms, treatment for Angelman syndrome may involve anti-seizure medication to control seizures, physical therapy to help with walking and movement problems, communication therapy, which may include sign language and picture communication, behavior therapy to help overcome hyperactivity and a short attention span, and to aid in development. Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.
Okay. So, just in case the video went too fast for some and you weren't able to write down everything that you needed to, I'm going to recap the basic points from the video. So basically, the etiology is that Angelman syndrome is basically a genetic disorder that causes developmental delays, neurological problems, and sometimes seizures. And it majority of the times attacks the nervous systems. Some signs and symptoms are feeding problems at birth. Well, not at birth, but from like 0 to 3 months, basically, because they're going to come out fine at birth, but then they're going to develop feeding problems. Developmental delays, and as we all know, especially after doing that long notebook, we should know by the ages of 6 to 12 months, they will be having those developmental delays. So we should all know what those are by now after doing that homework. So basically, the crawling, the babbling, and the stuff like that, they will be showing slow development with that. And then difficulty with balance. So they will have stability problems. They are very happy individuals. They're very hyperactive, and they have an excitable personality. As you see in the video, he was saying they're always smiling, clapping, and laughing. And then also the seizures begin from ages 2 to 3, and then seizures and the speech impairment, they will be dealing with that basically for the rest of their lives with those problems exactly. Okay, so how this disease can be diagnosed is by a blood test, a DNA methylation test, like he said on the video, basically just determines the genes from your parents, whether or not if you're going to have it, or like your chromosomes, how the way your chromosomes are set up, and if you're missing any parts from the chromosome, basically the stuff they were saying on the video. And then a gene sequencing test is basically a test that they will require you to do after you take a DNA methylation test. If, like, say it comes back positive or something, or if they need just basically a follow-up, or they need more information, they're going to send you to get the second test done. Some treatment options are, we know that there's no cure. Basically, only thing we can do is manage the symptoms, so we can work on like those developmental delay problems and the balance and the seizures and stuff like that. We can help with those seizure medications. Like in the video stated, they can work on communication therapy. And so basically it's not speech therapy, it's communication therapy, because for those who cannot speak, they will have to do sign language, or like the video said, doing those picture therapies. And then behavior therapy, of course, to work on that hyperactivity, the attention span, and just that all the energy that they have in their bodies. And then PT, of course, to help with walking, because we don't do that. Okay, so some functional limitations. These are some obvious functional limitations that you will see with a child or an individual with Angelman syndrome. So it would affect their occupations. So some of their occupations, ADLs for sure, because they will have severe delayed self-care skills. So we all know that I just stated how they were going to have developmental delays by coming up. So, of course, they're going to have delay with self-care skills. So they're not going to be able to dress themselves, bathe themselves, cook, do all those simple ADLs that me and you can do. They won't be able to do without any assistance. Sleep and rest, like the video said, they're going to have sleeping disorders. And to me, I was a little confused at first. Well, not confused, but I was wondering why they have sleeping disorders. But then I came to like realization that maybe it's because since they're so hyper and they have so much like hyperactivity going on in their body, maybe it's just hard for them to like wind down and actually go to sleep or actually just be calm for that long period of a time. Maybe that's the reason why they have sleeping problems. So that's just my own definition I'm coming up with, because there wasn't like no defined answer on that. And so their education will be affected because of their behavior problems. So since they are hyperactive, they have a short attention span, this could be a distraction in the classroom setting. So even though, they're not doing it on purpose and stuff, they can't help it, but this would distract other kids. And I was also reading up on some more stuff, and it said that they have, with their hyperactivity, they also have a habit of biting and screaming. So you can imagine that going on in the classroom. That's not going to be effective. And then also communication problems. This is also going to affect their education, because for one, if they can't communicate to their teacher, what they're trying to say or what they need, then that's of course going to affect their education. And then if they're not able to write or to type or whatever to do their homework, that's also affecting their communication. And then, so planned leisure. So when I was thinking of this, I was thinking of more, like a child with Angelman syndrome. And I was just thinking about like recess. So like when it's time for recess and like all the kids go out and play on the playground, this child with Angelman syndrome, since they have that gross and fine motor coordination, that's just not going to be right, they're not going to be able to like play on the monkey bars, and they're not going to be able to like maybe walk up the stairs and go down the slide or whatever, because that motor planning is just off for them. And then again with sports and after school activities, so with like sports, of course they're not going to be able to play sports with a gross motor delay. Like they're not going to be able to do that when their motor planning is off. And then after school clubs and like programs or whatever, they might not be able to attend those, because some might say like their behavior problems are too bad, or they might not be able to do like some club and stuff because they can't communicate effectively. If you can't get across basically what you're trying to say, then that's going to hinder you from doing things. And so some performance skills, their motor skills, of course, I just talked about their gross and their fine motor. All that's going to be off. Their motor planning is just off completely because it attacks the nervous system. And then their processing skills, like the video said, that most people with Angelman's disease, they have intellectual disability. And then social interaction. So you're probably wondering why I didn't have social participation on the occupational side, but I have social interaction on the performance side. And this is because the child or this individual will not have problems with social participation, because like the video said, they're always happy, outgoing, they're filled with energy, laughing, and they're so hyperactive, they would never have a problem with socially participating in a setting, even if they like even if they're off to themselves or whatever and they're just laughing, or just because they're in a room with a group of people, they will be able to socially participate. But the problem comes in with the with the interaction. So even though they're able to socially participate, they will have problems with the social interaction because of their severe speech problems. So they won't be able to communicate effectively in a social participation, if that makes sense. So, and like with their behavior, they can participate, but the way they participate, like their interaction is not going to be effective, if that makes sense. Hopefully I didn't mix it up, but hopefully I got it. And then, so our OT intervention, how we can help them is, of course, we can work on those fine and those gross motor skills. So like with the fine motor skills, they need that because of course they have to like write in school, they have to be able to type, all that kind of stuff. They have to use their hands for any kind of like self-care, button up buttons and like zipping up zippers, anything like that. We can work on all that. So like we can work on all three pinch grips. We can work on like the grasp, and like say like an activity for like working on grasp could be like crumbling a piece of paper in their hand, and that's working on like that fine tuning, the fine muscles in their hand. And then you can probably get more specific if you have them manipulate those that piece of paper in between their fingers. So that can help on that. And then gross motor, of course, their main gross motor thing that they're going to be working on is like maintaining how to walk. And so since we don't do that, PT does that. But what we can work on with gross motor is helping with that gross motor planning and that gross motor sequencing, like doing just big movements and stuff like that. We don't have to just necessarily work on walking, since we don't do that anyway. We can do other things with gross motor. We can also help with medication management. And so this is going to be for like those who are on that anti-seizure medication, who have like bad seizures and stuff. We can just educate them on like the type of medication they're on, educate them on, like when they should take it and how important it is to take it to keep those seizures regulated and stuff like that. And then balance, we of course can work on balance with doing anything really. So like some examples for working on balance is you can do any activities like reaching across the midline. You can have them standing while you're treating them, or while you're doing something else with them. You can have them standing while doing the activity. You can also have them shifting their weight back and forth from left to the right side. And then you can also even do exercises on their knees, and that can help them create that core stability and work on their balance. And then last but not least is the self-care. Of course, we focus on that heavy. So we're going to be working on all those things that they need to be able to be independent in self-care. So we can educate them on all the assistive devices and technology that we know and we have out there. So for like ADLs, we can say we can educate them on like the shower chair and like the dress and the sock aid and like energy conservation techniques and stuff like that, just to be able to help them get independent with like dressing and bathing and stuff. And then for like cooking and stuff, we can still educate them on all the assistive technologies and devices that we have out there, all the built up spoons and the like the sticky bottom pans and bowls and stuff that doesn't slide around and stuff like that. So basically our job is to just educate them and to teach them on the things that they need to become independent. And I believe that's it. So here's my references. That's it. I hope you guys enjoyed it, and have a good rest of your day.